Aboriginal Child and Youth Healthcare Jurisdiction. On September 7, 2017, Ojechita Francis Kavanagh of Grand Council Treaty 3 and Minister Michael Coteau of the Ministry of Children and Youth Services signed a historical relationship agreement in Kenora. The agreement acknowledges the co-implementation of the Ontario Indigenous Children and Youth Strategy within Treaty 3 in order to meet the needs of Anishinaabe children and youth through health services that will best benefit them. This is the first step the provincial government is taking towards the eventual transfer of jurisdiction of healthcare to Treaty 3. In order to successfully achieve the transfer of jurisdiction, the Ontario Indigenous Children and Youth Strategy is to be implemented into the communities of Treaty 3. The vision of the strategy is for First Nations, Métis, Inuit, and urban Indigenous children and youth to be healthy, happy, resilient, grounded in their cultures and languages, and to thrive as individuals and as members of their families and nations or communities. To properly meet the needs of these children and youth, the strategy's focuses include transforming Ontario's relationship with Indigenous children and youth and their families, enhancing First Nations jurisdiction and Indigenous control for children and youth services, prioritizing preventative services for Indigenous children and youth that are culturally appropriate, building high-quality integrated services network that supports Indigenous children and youth, enabling government and Indigenous service providers to track and evaluate their work in implementing the strategy. Through these, if properly implemented and followed, Indigenous communities will see significant change in the healthcare system for their children and youth and the ways in which it is approached. An important pillar of the Ontario Indigenous Children and Youth Strategy is that of holistic action and focus on culture. As the Ontario healthcare system and that of other Canadian provinces and territories relatively lacks holistic approaches to treatment, Indigenous peoples often feel pressure to conform to colonial institutions. A notable supporter of the strategy is the Journey Together, Ontario's commitment to reconciliation with Indigenous peoples. A step towards reconciliation can therefore be achieved once the systemic barriers to accessible and culturally appropriate healthcare have been dismantled. When analyzing the significance of this relationship agreement, it is important to first acknowledge how Treaty 3 was created and how they were put in this position. Originally the home of the Saulteaux tribe of the Ojibwa peoples, Simon J. Dawson and Robert Pither were responsible for connecting them to the Crown to proceed with land negotiations. Treaty 3 was signed on October 3, 1873, between the British Crown and the Saulteaux peoples. For this reason, the transfer of jurisdiction of healthcare in particular was never made to Canada from the British Crown, thus preventing Treaty 3 from previously having the opportunity to reclaim jurisdiction over healthcare for their youth. As demonstrated in the map, many treaty lands overlap between provinces and territories, thus complicating the situation. For example, Treaty 3 consists of land in both provinces of Manitoba and Ontario. When provincial matters such as healthcare are brought up, governments often become overwhelmed with jurisdictional issues. According to the National Collaborating Centre for Aboriginal Health, quote, "The Canadian health system is a complex patchwork of policies, legislation, and relationships. Further complicating the system is the multiplicity of authorities who are responsible for health services and programs. The federal, provincial and territorial, and municipal governments, various Aboriginal authorities, and the private sector. Aboriginal healthcare in Canada has become even more complex as a result of self-government agreements and other mechanisms to expand Aboriginal people's involvement in the provision of locally needed services and programs." Unquote. In their paper entitled "The Aboriginal Health Legislation and Policy Framework in Canada," the Centre identifies the previous and current legislation that further constructs barriers to equitable health care for Indigenous peoples. One of these documents is the Indian Act, which once made it unclear as to who exactly was responsible for the health of Indigenous peoples. In 1989, the health transfer policy was passed to provide an opportunity for Aboriginal communities south of the 60th parallel to assume control of resources for community-based health programs at their own pace. So why are there so many communities still under provincial, territorial, or federal jurisdiction and not their own? The answer is simple. The ministry responsible for healthcare must be willing to enter into an agreement with the community as Ontario has done with Treaty 3. While understanding the complexity of jurisdiction in Canada, it is important to acknowledge the fatal consequences these issues entail. Jordan's Principle has been created as a means to prevent a young death from happening once again. Jordan River Anderson of Manitoba's Norway House Cree Nation lived his entire short life in hospital due to governmental disputes over the jurisdiction of the care of his rare neuromuscular disorder. Following his death, the House of Commons adopted Jordan's principle on December 12, 2007. According to Health Canada, quote, as of October 31st, 2017, 24,196 services and supports have been approved for First Nations children under Jordan's principle. These include mental health supports, medical equipment, speech therapy, educational supports, and more. Cindy Blackstock, Executive Director of First Nations Child and Family Caring Society and strong advocate for First Nations child welfare, explains the issues surrounding First Nations child and youth healthcare jurisdiction and accessibility.
Jordan River Anderson from Norway House Cree Nation is one of those children. He was born with complex medical needs. For the first 2 years of his life, he stayed in hospital not far from here in Winnipeg Children's Hospital. But after his second birthday, he should have gone home. All the services were ready for him to go home. But what did the government of Canada say? Oh, well, it's really good that Jordan can go home. But we're not sure we have authorities to pay for his at-home care. The province of Manitoba said, Jordan is a federal responsibility. He's a status Indian child on reserve. We don't want to set the precedent of picking up a federal cost. There's no question about it. If Jordan was non-Aboriginal, he would have gone home that day. But as it was, the government officials thought it was okay for that little boy to stay in the hospital while they argued over who should pay. In making that decision in the first instance, they allowed themselves to cross over that bridge of saying that racial discrimination against a child, because no other child would have been denied the opportunity to go home, no other child, that by crossing that river and saying that because he's First Nations, he can stay in hospital while we figure out who is going to pay from our respective surplus budgets. They then entered into the realm of the immoral. And not just days passed on Jordan's calendars, but days turned into weeks and weeks into years. And this little boy would have other little kids come into his hospital room, and they would all get better, and they would go home. And he was better, and he wasn't going home. The other boys would talk to him about what it is to put both feet into a mud puddle and get all the water spraying upwards, or what it is to put your arms around a big dog, or to hear the drums in your cultural ceremony. And he had done none of that. He was trapped in the hospital. His family, his community, the doctors, and the nurses were all pleading with the governments to do the right thing. Let this little boy go home. But the governments didn't listen. They were afraid of setting a precedent of picking up somebody else's cost. And so it was that just after Jordan's 5th birthday, he lost hope and he dies in Winnipeg General Hospital, never having spent a day in a family home. At the time when Jordan passed, we did a study of only 12 of the 108 First Nations communities running First Nations agencies in this country, and we found 400 other children in the same situation that Jordan was in, being told, no, you have to wait while we figure out who should pay. Jordan's principle is simple. It applies when a government service is available to all other children. So basically, if you are non-Aboriginal, you get the service. That's when it applies. And one of these crazy payment disputes crops up. Whoever gets contacted first, provincial, territorial, or the federal government, pays for the bill, and they argue as much about it as they'd like after. It's a very simple principle. It passed unanimously in the House of Commons in 2007, but it has never been implemented by any provincial government or properly by the federal government. The federal government has sought about to do even something more disgraceful. And that is to narrow this little boy's legacy to say, no, Jordan's principle does not apply to all government services, only services for children with complex medical needs. In an apparent attempt to try to dissuade Canadians' attention away from the broad-based discrimination that happens over other services, I would ask that each one of you in your union locals and in your members join our supporters of Jordan's principle. You're about to learn of 7 free ways to make a difference. They're available to people of all ages, organizations, as well as people of no income, because it is completely free to support these different causes.
Cindy Blackstock's passion for the issue clearly resonates throughout the video, demonstrating just how unjust and preventable Jordan's death was. Potential legal claims surrounding Aboriginal child and youth jurisdiction of healthcare are straightforward. Firstly, variations in healthcare legislation between provinces and territories make policies complex. As previously mentioned, treaties that were signed before the formation of present day provinces and territories often occupy land within more than one border. It remains unclear as to how the federal government determines who upholds jurisdiction for said area. Secondly, self government agreements are becoming more common in the last few decades, although there's still a small number of existing ones. The Niska Nation, for example, is responsible for distributing healthcare for its members, making it independent from the British Columbia government, as well as Canada's in this dimension. A third and crucial legal issue is that of human rights. As discussed by Blackstock, all governments foster a clear discriminatory pattern regarding the equality and accessibility of healthcare for Indigenous peoples, particularly among children. Jordan's example is one of many sad instances and is completely preventable. The very fact that no level of government has made attempts at implementing Jordan's principle should not be tolerated by the Canadian population. According to Alberta, Ontario, Saskatchewan, and New Brunswick legislation, said province's health minister may choose to enter into an agreement with Canada and/or First Nations for the delivery of health services if they choose. This clearly indicates that the provisions of health services are outside of the province's mandate. All in all, understanding Canada's past with Indigenous peoples is crucial in the analysis of current healthcare legislation regarding their children and youth. Settler colonialism continues to prevent Aboriginal children from accessing culturally appropriate and equal healthcare in relation to non Aboriginal children. The variation in legislation among provinces and territories complicates the issue of who has jurisdiction to distribute healthcare among our Indigenous populations. Racial discrimination is further evident through the government's lack of implementation of Jordan's principle and other similar healthcare policies. This leads many Canadians to wonder what will happen next. Is Treaty 3's case special, or is Ontario actually committed to Indigenous communities' independence in relation to the care of their youth?